Hello, Dr. Loetscher here. So I want to talk a little bit about recovery from third molar surgery, removing your wisdom teeth, which we do quite a bit of, and a lot of it's on children, the high school age kids and college students. And so we do these in the office, we put you to sleep for it, and you stay here for about 30 minutes afterwards, and you walk out the door and go home. And you're a little groggy that day. Quite often you go home and take a nap. A couple things that a lot of people think about a lot are the swelling and the discomfort. So we do a lot of these on Fridays, and most kids can go back to school on Monday. As far as the swelling goes, you're going to get some puffy cheeks the next day, like on Saturday, and Sunday it's about the same, and by Monday it improves quite a bit that you can go back to class. We do give you an ice pack to wear, which helps a lot with the swelling. As far as the pain control, we actually are pretty good with that nowadays. We actually give you some Novocaine that keeps it numb for about 8 or 10 hours. That helps a lot. It gets you through the day, and by the time that wears off, most of the pain's gone. Then we give a couple kinds of pain medication. We use Motrin, like 600 milligrams of ibuprofen. We also give patients a prescription for a narcotic. And most people use the Motrin and maybe add a little bit of narcotic to it the next day or two if they need to. But for most patients, they don't look back at this and say, oh, it's really painful. They just remember puffy cheeks for a couple of days. So the next day, they do some exercise. You go to movies with your friends. You go swimming in the pool for the summertime the next day. You're just gonna have some puffy cheeks. As far as eating goes, the day we do it while you're numb, you need to eat softer foods. But the next day, the Novocaine's worn off, and you can have sandwiches, pizza, and you can eat most foods. You just need to avoid popcorn kernels or bacon bits on salads for about a week. Maybe avoid a straw for about a day or two. So in general, it's a pretty quick recovery for most kids, and they just remember that they're kind of puffy cheeks for a couple of days, and they go see their friends the next day if they're up for it, and everybody's a little different. Sometimes you need a couple of days longer on that, but it's a pretty quick recovery.